Hey everybody, Buck Buckminster with 360 Louisville back here at the Getty Eye Center, and I'm with Cassie. Cassie, I understand that you're actually a certified Paraoptometric Technician.
Yeah, I am. And what we do here at Getty Eye Center is we just assist the doctors. We use the instruments. We get the doctor or the patients ready for the doctor.
So, a Paraoptometric Technician, certified.
Yes.
You help assist the doctors. You get us ready. Now, I've had an eye exam before. So, you're the individual that goes to this equipment, sits me down in this chair, and gets me all set up.
Exactly.
And makes sure that I'm comfortable, but that the equipment's ready for the doctor to come in and actually do the exam.
Correct.
Wonderful. Well, that's
Yes.
very important.
Yes, it is.
Well, tell me what makes it fun here at Getty Eye Center? What as a patient, what should I expect from you and the doctors when I come in here? What's going to make this a better place to get my eyes examined and my vision cared for over the years than anywhere else?
Well, here at Getty Eye Center, we really do care about the patient and their eye health. We try to make everyone feel relaxed when they come into the office. We don't want, patients to be nervous because sometimes, you come into a doctor's office and you do feel nervous. But, we just try to make it fun and, just provide excellent eye care.
Awesome, awesome. And what do you think, in your estimation, makes the Getty Eye Center special?
Well, that we do really care about the patient.
Right.
You could go to a lot of different eye doctors, but here we really do have the health of the eye as our primary concern.
Okay. You've been working here for how long?
3 years.
3 years. What's been the most interesting thing in those 3 years that's happened with a patient and with you?
We have actually found tumors in the brain based on the way that the optic nerve looked.
And we found that optic nerve situation via the exam conducted by you and the doctor.
Correct.
Through some of this equipment.
Yes.
Wonderful.
Yeah.
Well, that's pretty profound.
Yeah, it is.
Very profound.
Yes.
Okay.
And a lot of people question why they have to get their eyes dilated at every exam, and that is one reason why, because there's things that can go on in the eye that affects, the whole health, and patients may not even be aware that there is something going on.
Do you do the dilation?
So,
is that part of what you do?
Yeah.
Okay, cool.
Yeah.
All right.
Yeah.
Very nice. Very
And
nice.
we also do the Optomap retinal exams, so that's kind of an alternative to the dilation if patients don't want to have their eyes dilated.
Tell me about that. What did you call that?
It's an Optomap retinal
Optomap.
exam.
Okay.
And what we do is we just take a digital picture of the back of your eye,
Okay.
and it gets out 200 degrees, so you can see, the entire retina. You see the optic nerve, the macula, all the blood vessels, and it's just a really cool tool that we can use, to aid in checking the health of the eye.
Absolutely. Absolutely. Wonderful. Okay, Cassie, great stuff. But over here to my left is some very interesting equipment. Why don't you tell me a little bit about that? Because I know in the past when I've had an eye exam, I've seen and used or been a part of some of this. But could you walk me through it and tell me a little bit about some of this?
Sure. Okay.
Great.
The instrument directly to your left is called a phoropter, and what that does is it allows the doctor to read your prescription through that.
Okay, and this thing over here.
That is a slit lamp, and it's kind of like a big microscope with a light on it, and that's what the doctor uses to check the health of the front of the eye, and then also after the patient is dilated, they can look to the back of the eye through that instrument as well.
Okay, and while you're doing all this exam, I take it that you can record it all and put it up on a screen for me and we can talk about it?
Correct, yes. We can take a live video with that as well,
Nice.
or take pictures of eye injuries or lid issues or corneal issues.
Wonderful.
So, yeah, it's a really good tool to have. We also specialize in glaucoma. We have a glaucoma specialist, Dr. Ben Gaddy, and as a technician, we perform the testing for the glaucoma. We have different doctors referring us patients here as well.
Wonderful. Tell me about working with kids. I have a 7-year-old.
Yeah,
Just turned
we love
7.
kids. Yeah. Okay.
Tell me about working with kids.
Yeah, working with kids is obviously different than working with adults because they're much more nervous. But we try to make it fun. We have different, different things that we do with them, like stereo testing, color vision. Instead of doing like letters on the eye chart, we can do pictures or shapes to make them a little bit more comfortable with the exam.
Okay.
And
Neat.
so
Very neat.
yeah, we all
Okay.
have kids, so
It's
we
gotta
love
be
them.
fun working
Yeah.
with kids.
Yes, it is.
Very good. All right. What else? Anything else you can tell us that makes my experience as a patient better here at Getty Eye Center? Or that,
Well, you know, we all get along really well, which I think makes it work a lot better.
Sure.
You know, the doctors and the staff really work together, and
Okay.
so
Very
yeah.
good. Very good. Cassie, been a pleasure visiting with you today. Thanks so
Thank
much
you.
for your time.
All right.
And I'm sure we'll see you at my next eye exam,
Yep.
right?
All right.
All right.
Very good.
Thanks, Cassie.
Okay,
Back to you,
thanks.
Jim.